Hey guys, I'm Dr. Gonzalez and welcome to another video. Today we are discussing the following topics. And you know what? Let's just go ahead and get started. The cardiovascular system is composed of blood, heart, and the blood vessels. But the heart, as you can see here, is a fist-sized muscle that is located within the thoracic cavity or thoracic cage. The heart is a four-chamber organ. As you can see here, it has the left atrium, the right atrium, the left ventricle, and the right ventricle. And it is primarily composed of the cardiac muscle tissue. As you can see here, this is the cardiac muscle tissue where you can observe the cardiomyocytes, the nucleus of each cardiomyocyte, the branching and intercalated discs. The heart pushes blood to every organ, including himself. So deoxygenated blood empties from the right atrium into the right ventricle, and then it flows to the lungs for gas exchange. Then oxygenated blood from the lungs enters the left atrium, and then it empties into the left ventricle. And so from there, it is going to be pumped into the aorta towards the body. Hey guys, I'm going to make a quick stop right now so that you can like this video, because that will really help me with the YouTube algorithm to spread the word to other students and health professionals like yourselves. And also subscribe if you're enjoying this channel and this video. All right, let's continue. Within the heart, one-way valves direct the flow of blood through the four chambers into the attached great vessels. So for example, the mitral and tricuspid valves, also known as the AV valves or atrioventricular valves, will facilitate the blood flow from the atria into the ventricles. Now the aortic and pulmonary valves, both of them are semilunar valves, and they prevent the backflow of blood from these great vessels, such as the pulmonary trunk and the aorta. Now, protecting the heart, there is a serous membrane called the pericardium. And so, as you can see here, the pericardium is a serous membrane that it's protecting the heart. And in between it, there's going to be a space observed called the pericardial cavity. So that's in between the pericardium and the heart, right? Within that pericardial cavity, there's going to be a serous fluid called the pericardial fluid, or just serous fluid. And this fluid provides lubrication. Lastly, remember that the pericardium is divided into the parietal pericardium and the visceral pericardium, also known as the epicardium. This is your heart. This is your heart when your lover says, "We need to talk." Me stay at my house. Me going to the grocery store. Me when someone near me coughs. This is the real thing. Okay, so what you're looking at is a coronal cut of the heart. And what you're looking at right here is the right ventricle, and this is the left ventricle. On this side, you're looking at the other half of the left ventricle right here, and this is the right ventricle. I know it because of the thickness of the ventricles. The left ventricle usually is thicker than the right ventricle. So if you notice, the wall here is thicker. You see that wall of the heart. So another thing you're gonna see is the valves. So for example, this right here would be the bicuspid valve or mitral valve, also known as the left atrioventricular valve, with the chorda tendina right there. Kind of looks like a parachute, right? And then this right here is one of the papillary muscles attaching that chorda tendina. You see it on the other half. You see this is the other half of the valve right here. This is the other chorda tendina and another papillary muscle right there. Right. In the right ventricle, you're also going to see it. And this is the tricuspid valve right there. This is the porta tendina. You see some porta tendina right there. And then this right here is one of the papillary muscles attaching those porta tendina. Now this thing right here that's sticking out, it's called the moderator band. The moderator band is only located on the right ventricle, and it kind of like helps the ventricle to not overextend when it relaxes and then contracts. So that's called a moderator band. Remember that from here down, these are ventricles. From this point superiorly, right, there's going to be the atriums. Right, so this is one of the atriums. In this case, the left atrium. Right, you see the other half right here. And then on the right side, that's the right atrium right there. And then you can also see some of the blood vessels. For example, this one right here, it's the aorta. I know it because it's parallel to the to the left ventricle right here. And then this is what we know as the aortic valve. See part of the leaflets right there. And if you enjoyed this video and you want to know more about this system, just click on the card on top of this video or wait at the very end so that you can observe or see the suggested videos. And that is it for today. Thank you for watching. Please don't forget to subscribe, like, and share. And if you have any comments, questions, or suggestions, feel free to comment on the comment section below. I feel like I said comment a lot, but anyways, you know what to do. Thank you for watching, and I'll see you on the next video. Bye.